name's Ashley. It's nice to talk to you guys.
Hello, Ashley. My name is Susie, and I'm going to be one of the LVTs that's talking to you about your pet's profile today.
Hi, my name is Casey Gar. I'm also LVT here at the Delphi Clinic.
So I'm going to first start off with our surgical consent form. So this form is just basically before you send off your pet to anesthesia, it's just going over some things. So we have just the client name, the pet's name, your address, your home phone number, and your cell phone number, just in case we need to reach you, and just in case of an emergency. Your pet's information, the surgery that's going to be performed. Did your pet eat this morning?
Can I ask a question? Is there a reason my pet shouldn't be eating before surgery?
So this question is actually very important. So before surgery, we like to fast our patients. This is because due to the medications we give them, it could possibly cause them to throw up during the surgery, and we don't want them to breathe that back in.
It could cause ammonia in future problems.
So that's just like a health safety hazard that we have to ask. And then we have any current medications that your pet's on, and just a little paragraph saying that you understand the risks that may happen when your pet goes under anesthesia.
So am I basically signing just like in case of a lawsuit, like in case in case something happens, I decide to
Yeah, so this page is legally
it's a legal document.
Got it.
So if you go to court, we can use that.
Okay, because I signed it and said I was okay.
So you understand all the risks.
And the veterinarian also signed that too.
Okay, perfect.
So the next page that we want to discuss with you is the discharge instructions. This is after your pet gets out of surgery. So we just have the diagnosis, what's going on with your pet, any treatments or tests, medications that they need to be on for pain maybe.
So I have a question about the medications. Would it just list what medications that my patient is getting, or would it tell me like what route I should give it, how many times a day, the dosage? Would that be included?
So under the medication section, it should say everything you need to know about the medicine. How many times a day you give it, what route, like giving it by mouth, how many capsules.
So that will all be there, so I won't
So you won't get confused. And then we have just your level of exercise after the surgery, any dietary restrictions, the recheck date, which could be in 2 weeks, a week, and any more additional instructions.
So for the dietary restrictions, would it be best to not feed my patient after surgery?
So usually after surgery, we like to cut down their meal for the next meal and
limit water intake.
Yes. Just so we know they're still going to be groggy.
And so you just need some time to get adjusted.
Yep.
Okay.
And then maybe in like a day or two, they can go back to their full meals.
Okay. And then for the recheck date, would that be a date with the veterinarian just to check that they're okay after surgery?
Any incisions or anything?
Yep. The doctor will be there just to check back with the progress of your patient.
Okay. And then additional instructions, what usually goes in that category?
So this could be anything from wearing an e-collar,
prevent any other animals accessing the other.
Okay.
Yep. So that's basically going to be that sheet.
Okay, this here is the mass and problems list. You got your problem number, the date, the patient that is in here, the diagnosis, the active and inactive problems, which also is active problems, risk factors, and allergies.
So if my patient was allergic to like a rabies vaccine, would that go under the allergy
yes,
part
that
of
would
it?
go under allergies because that is a very important thing. You don't want to inject them with anything they're allergic to. Also let the veterinarian know about that. The flow chart, that's basically like a timeline. So say if your patient got bit by a tick like 2 months ago and they test positive now, it just kind of gives us a general idea of what time it happened.
Oh, so that would be a good way to diagnose a problem.
Yes,
like, she didn't just develop Lyme disease. It would be from a tick, and that's what the flow chart's for.
Yes.
Got it.
And the ICD-9 code, that's for a computer base. It basically just sends us like codes for like kidney disease or heart problems or blood problems.
That's very good to have.
Yes, it is. Comments from either the LVTs or the veterinarian that we'd like to know about, and when the date ended.
So that's in my patient's file?
Yes, this is like a overall health file.
All
So
of
every
these sheets are going to
Yes.
be in
Okay,
your
so every
patient's
time you
file.
go in the file, they're all in there just for
Yeah, and you
general
can also get
information.
copies of them.
Okay. Perfect. Well, that helps me a lot. I appreciate you taking the time to go through everything. You did a great job explaining.
Of course, if you have any more questions, feel free to call the clinic and we're happy to explain anything more.
I will
to you.
ask for you guys. Thank you so much.
Of course.
You're welcome.